Welcome to Doctors on Call. I'm Jenna Miller. Physical therapy is a practice that's been used for thousands of years. Physical therapy treats many conditions, including mobility issues, chronic headaches, inner ear dysfunction, and even Parkinson's disease. Physical therapy can not only treat existing conditions, but it also helps you improve your health by allowing you to live a life that is as mobile and pain-free as possible through prevention. Physical therapy, it's our topic today on Doctors on Call with our guests, physical therapist Troy Herrman and Kirby Rice.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.
Troy Herrman is originally from Ensign, Kansas. He attended Fort Hays State University and graduated with a degree in biology. Troy then received his Master of Science degree in physical therapy from the University of Kansas Medical Center. After working in St. Francis, Scott City, and Hays, Troy created Herman Physical Therapy and Wellness in 2017. Kirby Rice attended high school at Smith Center. He graduated from Sterling College with a degree in athletic training. He then attended Wichita State University to acquire his Doctor of Physical Therapy degree, graduating in 2016. Kirby spent 4 years working in Hutchinson as a physical therapist at Pinnacle Rehabilitation and Sports Performance. Kirby enjoys working with all types of patients, but specializes in orthopedic rehabilitation and sports injuries. He is also certified in dry needling. Give us a call at 800-337-4788 toll-free with your questions about physical therapy today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or therapist. Thank you both so much for joining us again after a hiatus last year. We're glad to have you guys back.
Good to be back.
First of all, let's talk about why patients need physical therapy.
Well, you kind of mentioned a couple already when you talked about rehabilitation following surgeries, but I think one of the big things for us over the last several years is having that direct access. So anytime somebody has pain, they don't have to go see their physician first. They can come directly to a PT who, we specialize in musculoskeletal conditions, things that maybe you're having hip pain or shoulder pain. You come into us and we can figure out what's causing that pain and then try to treat it.
Is it true that sometimes physical therapy can keep a person from having to have surgery?
Absolutely. A lot of times insurance companies will prefer or recommend that patients have therapy before opting for surgery. And many times in those situations, we're able to find a group or set of interventions that allow the patient to kind of manage their symptoms and not have to go forward with surgery.
How do I find a licensed therapist that is a good fit for that person?
I think a lot of our patients find us through their friends. And I think most of the time your friends fairly well, and if it worked for one of your friends, there's a good chance it could work for you too. You can go out online. It's Find a PT through the APTA, and most of your PTs are registered there. But just your local community. Anymore, we utilize social media and those different platforms too. I think that make it easy to find somebody who's a good fit for you.
What do you find that your patients that come in, what are some common conditions that they have that requires physical therapy?
I would say absolutely the most common diagnosis that we get in our facility is probably low back pain and neck pain. The numbers are pretty staggering with low back pain, And I think up to 80% of individuals, somewhere right around that number, at some point in their life or not, will have an onset of low back pain occur to them. So I would say that is probably, without a doubt, probably the most common issue that we have come in to seek treatment for.
And how often do you typically see a patient?
So there's a wide range of what we do on that. Most of the time we'll start out at 2 to 3 times a week, depending on their condition. If they're somebody that's really acute, you're going to see them a little more frequently to begin with, and sometimes we'll see people for several weeks and or months, depending on their rehabilitation. And at that point, you're seeing them maybe once a week, once every 2 weeks, as they're getting more independent with their home program, and they don't need you as much to do a lot of the things for them. So.
And how important, I think we've talked about this before, but how important it is for a patient to go home and do some work themselves before coming back in?
That's a great point. I think when someone is coming to physical therapy or having a pain of any sort, I think it needs to be viewed as kind of a holistic approach, kind of as a program, and that needs to stay consistent with. Once a week or even twice a week of 30-minute session is not very much time of your week, and so it just needs to be kind of a holistic approach and a program overall, and something that needs to be stayed consistent with.
Sure. Now, when a client comes in for the first time, what typically takes place during that first examination?
So one of the most important things we do is get the history from the patient. And they sit down and we find out what's going on. What are your symptoms? What's your history? Have you had any injury? How long has it been going on? What all have you tried? I'll get all of that information from them. After we do that, then we do our physical assessment, where we'll run them through some special tests, try to figure out what's the cause of the problem. And if you can find that cause of the pain, you treat the cause of the pain. And that's one of the things that PT focuses on. It's not about treating the symptoms, it's about treating what's causing the symptoms.
And do you find there are any misconceptions that are connected with physical therapy?
I feel like a lot of times people kind of have the misconception that when they come to therapy, they are going to experience pain. Sometimes the things that we do are not the most comfortable or the most appealing, especially for a person who's right after surgery, just a couple days. Almost anything we do with them is going to be very painful. And I think, once again, it's kind of a program approach, a big picture type mentality, and that although you experience pain today, tomorrow or in a few weeks from now, you'll experience great triumph.
Sure. Now, what's the difference between physical therapy and going to the chiropractor?
Which we actually talked about this on the way out. This seems to be something that we talk about every year, and the reason is there's a lot of similarities in the group of people that we see. You can have very similar approaches between a PT and a chiropractic, or they could be vastly different. Chiropractors tend to, in general, practice more towards the manipulation of a joint, where a PT, we may still work on the joint, typically don't do as many manipulations, although we can, more about mobilizations. And then we address soft tissue, I think, typically a little bit more the strength component and range of motion component, as opposed to treating just a joint restriction. There's other similarities, other differences. Yeah, I mean, it's always a delicate question to answer.
Sure.
Too. So,
many joints in the body, and kind of to build on what Troy said, I think you have to get the appropriate combination or the right percentage of mobility with stability. The joint itself has to move. All the muscles, all the other soft tissue around the joint have to be strong and support that joint. And so you kind of have to have that perfect combination. And I think that's what we really work on in physical therapy is that combination in itself. And then strengthening and keeping the patient strong so they don't have to come back as frequently for treatments or have that popping intervention to fix their pain. to get them strong and healthy, and so they can further manage on them by themselves better.
Do you sometimes have chiropractors refer to you and vice versa? You refer to the chiropractor?
Yeah, we do have some relationships with some local chiropractors that are like, hey, you know, go get some therapy, and they know we're comfortable with that relationship, and vice versa. Like, hey, you know, I can't get your joint loose. It's going to need something more aggressive, and at that point in time, then maybe, you know, visiting with their local chiropractor can be beneficial.
We were talking a little bit before we went on the air about deep tissue laser therapy. Can you tell us a little bit about that?
Yeah, it's kind of, I'll talk a little bit and then let Kirby share his experience. So that's our latest modality, if you will, for a term. But we have a 25 watt deep tissue class 4 laser therapy system. And essentially what it does is it gives the body a little boost to healing. It goes in, it excites the cells. And I don't know if have you had some cell biology, if you can remember way back, the mitochondria, you know, people always talk about that, the powerhouse of the cell. One of the cool things that the laser does is it goes in and it stimulates that mitochondria to produce more energy molecules that our body can burn. So what may have before taken us 12 visits to work with somebody, a lot of times we can cut that down to maybe 8 visits because we can stimulate the body's own systems to help it heal a little bit quicker. So,
yeah, the laser's been a very great resource for us to have. I feel like people have responded very well to treatments, kind of muscular pathology, muscle strains, muscle irritation, muscle soreness, to kind of tendinitis, patella tendinitis on the front of the knee, Achilles tendinitis on the back of the heel. One thing that I also think is very unique about the laser is it has been a great tool to treat some of those chronic pain patients, patients that have had every treatment under the sun. They've been to this doctor, they've been to that doctor, they still hurt. Those type of people come in and really have responded well to our laser, which has been great for them because they've been everywhere and not had answers. So to get those type of people at least some type of relief is just a great feeling overall.
Yeah.
Do you use the laser therapy in conjunction with physical therapy? Do you have some patients that come in just to have the laser therapy? How does that work?
Most of the time it's in conjunction. You know, we introduce it to them that way. We do have some people that when they're done, they just love the feeling, and I think some of that's more of those chronic pain type patients that Kirby was talking about, your fibromyalgia, polymyalgia patients that just have muscle pain and doctors can't seem to figure out a reason for it. And they've tried all kinds of sort of different things and just haven't had relief, and they get relief from some of those conditions. So
I think that goes for a lot of the things that we do in therapy. You know, you'll talk to someone and they'll say, oh, I had this intervention or I had that intervention. This was awesome. This was great. This wasn't good. All in all, I think everything is kind of just a small piece of the pie. And when we get several combination of interventions, treatments, exercises, all put together is when physical therapy is most effective and sees the best results. Is kind of a culmination of many things rather than just one single standalone treatment.
If I can add to that just a little bit, one of the things that we've, I think, had great success with, and I know a couple of years ago we talked about the dry needling, functional dry needling that we do, which has a profound effect on muscle spasm and muscle dysfunction. And we've seen a fantastic combination, I think, with the dry needling when you combine it with the laser. You get that muscle spasm reduced, and then you introduce the laser, it allows things to heal, and we've had some cool results from that. So,
excellent. Sounds wonderful. We want to remind our viewers that we are talking about physical therapy tonight with Troy Herman and Kirby Rice from Herman Physical Therapy. I want to go back to the dry needling and give us a call at 800-337-4788. Toll free if you've got a question. They would be happy to answer for you. But you mentioned dry needling, and I think a lot of people are more familiar with acupuncture, which I've been told is the opposite of dry needling. Talk about that a little bit and what dry needling is.
So the main difference between acupuncture and dry needling is I feel like the dry needling is a lot more specific. Acupuncture kind of has a predetermined mapping where you place a needle at this location, this location, this location, and then kind of some healing takes place. For the dry needling itself, we as therapists like to get our hands on people. We will find a tight muscle or a muscular trigger point that we call them, and then that is what is causing the patient's pain, and so that's where we place the needle, and that's where we try and treat. And the treatment itself is designed to reduce the spasm, reduce the tension of that muscle, and therefore decrease the pain. So I feel like, to kind of summarize there, the main difference is dry needling is a lot more specific, whereas acupuncture might be, a whole half of your body or a whole limb type treatment.
Okay, we might talk a little bit more about this here in a moment, but right now we've got a caller on the line waiting to ask a question. So we'll go to the phone lines right now. This is Dolores on the line from Lincoln. Hi, Dolores. Go ahead with your question for our therapist tonight.
Okay, I have a son that has a pinched nerve, and he's... Hello?
Yes, go ahead. We're listening.
Okay, I have a son that has a pinched nerve in his back, and I was wondering if laser therapy help him. He's had steroids, physical therapy, and he takes gabapentin pain, and he's gone to a chiropractor and still has pain.
I think if I heard right, a pinched nerve, and yeah, so a lot of times they'll put them on gabapentin to help with some of the nerve pain. That's a common nerve pain med. But again, like one of the things we talked about earlier was finding the reason, what's the cause of the pinched nerve, and sometimes that can be a bony restriction in the low back. It could be a soft tissue restriction that's occurring in a different part of the body, and when I say soft tissue, I mean like muscular, and that could be due to a weakness. That's a repetitive thing going over a period of time. So by all means, an assessment and evaluation to determine what's causing the pinched nerve, and then try to release that pressure off of that nerve. Again, that's kind of what we do when we do our evaluations, like we were talking about earlier. So very appropriate individual for physical therapy.
One thing we did not mention about the laser is the treatment itself. The one thing that the patients do feel is a pretty strong or pretty good amount of warmth. In the low back, there's many moving parts, many small muscles, many small structures. I think absolutely your son would benefit from the laser treatment, but to further kind of build on what Troy said and kind of what I said earlier, I think just a piece of the pie, really. Just a small portion of what would be the best treatment program there.
Okay, wonderful answers. Going back to the dry needling, I feel like there might be a little bit of a stigma because you have the word needle in there, and that might be a little scary for some people. Let's put their minds to ease.
Yeah, well, some minds you can't put to ease. All you do is mention needle,
We'll
and then you can't do it. But they're very thin needles. Most of the time, patients don't feel the needle go into the skin. They feel it when you get a little bit deeper into the muscle sometimes, and then they feel kind of an ache or get what we call a twitch response. At that point, it may last for 5 seconds. The majority of time, once people do finally that are not comfortable with needles, they allow you to stick them with the needle. They're like, oh, that's it? It's in there?
Yeah.
And then it's fine. But we do have those people that just, the thought of a needle, they just can't do it. So.
Sure. And what about range of age that you work with? Is it a wide range? Is there too young, too old? Talk about that.
We really get all stages of life that come in. So I think you had maybe a 2 or 3 year old come in a little bit earlier this year for a different issue, and then
even month olds. We have 2 or 3 month olds come in at times.
And then we'll have those individuals who are 90 plus years old that still come in for outpatient therapy. So many ranges we can treat. There's always an ache, there's always an ailment somewhere at all ages of life. So that's always kind of a fun thing too, is to see who walks through the door and what's their story and why are they here. Yeah.
Sure. And speaking of walking through the door, does it take a doctor's referral to see you guys? Can they just give you a call? How does that work?
Yeah, just give us a call. That changed several years ago, but you can come straight in off the street, and we'll get you set up and seen. Not all clinics do this, but we offer free consults even. So if somebody's concerned about, I don't know if I want to pay for that, I don't know if you can really help me, then hey, come in. We visit with them and let them know what we can do, and then they can make that decision if that's what they want to follow through with.
And speaking of payment, do you accept insurance?
Yeah.
How does that work?
Yeah, basically we try to get in with any insurance company that we can. You can always accept any insurance, whether you're in network with that insurance, plays a role, but we try to be in network with any insurance company, that anybody that comes across our desk. So.
And what might a patient be experiencing that leads them to think, or might be a light bulb that maybe physical therapy might help me?
Obviously, I think the main reason that people come see us is pain. They're experiencing an ailment, they have an issue that's been going on for a while. Obviously, I think the sooner after that patient starts experiencing the pain, the sooner that they can get in to see us, I think kind of the better or wider their therapeutic window is, and I think the more we're able to help them. The longer a person waits, or we get all the time people that come in and say, I've had low back pain for 25 years. I think obviously kind of the opposite. I think their therapeutic window is much smaller, and maybe if we'd been able to work with them 25 years ago when they first started having the pain, their condition could be different at this time. One thing that the physical therapy profession itself is kind of trying to move towards is more of a preventative standpoint. We have had a couple young athletes come in who are getting ready for their season and have had various injuries in the past, a couple hip type, chronic hip pain type patients, young athletes that come to my mind, who have started treatment before their season starts. So then when the season starts, they don't have that issue. So obviously pain brings people in, but at the same time, many other things. And we like to kind of do the preventative thing as well.
And we mentioned in the intro, Parkinson's. Is there anything physical therapists can do to help a Parkinson's patient?
One of the most challenging things with Parkinson's patients is movement. Their movement is restricted or difficult. And, across our profession from the get-go, and I've been in the profession for a few years, it's always been a focus on movement. That's what PTs do. We want to try to get people moving, and more specifically, get people moving pain-free, fluidly. So we do work with Parkinson's patients for gait training. Trying to teach them how to walk again, showing them things they can do on a regular basis, trying to restore motion to joints that might be restricted, soft tissue that's maybe increased in tone so it doesn't move, it's not as flexible. So, absolutely.
Okay.
Any Parkinson's treatment, especially, maybe more than anything else in therapy, is the same thing, going to be that program approach. One treatment or 2 treatments is not going to do much for that individual, but kind of consistency and staying after it for a long while is going to be what that takes to help a particular patient with Parkinson's.
We have just a little bit of time left. What might a patient expect when you send them home to do stuff at home? Talk about that.
Well, I mean, we try to give them home exercise programs, print those out for them, and I don't know, I hear myself say it, I think I said it 3 or 4 times today as I was patient's last visit. I say, hey, do these pretty solidly for another month. If after that month's time you're feeling great, you know, you can back off of those exercises, but hang on to them, because as soon as your pain starts, you don't call me right away. Pull those exercises back out of the drawer, focus on those exercises for a couple of weeks. If you're still having issues, then that's when you would give us a phone call. But like Kirby had pointed out several times, it's one of the things that PTs focus on is trying to teach people how to manage a condition. We're not going to cure you. Unfortunately, our medical profession doesn't cure things, we treat things. And we try to encourage them to be able to treat themselves so that they don't have to spend their time, their effort, their money constantly going to see somebody that's going to help them out.
Okay, great. Thank you both so much for joining us again tonight. That was Troy Herrman and Kirby Rice. On our next Doctors on Call, we'll be discussing radiation oncology. Thank you so much for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.